so much for joining us for day 4 of Be a Jewish Upstander, a call to action in supporting immigrants and refugees during the time of COVID-19. Thank you so much for joining us today on day 4. If you missed day 1, 2, or 3, you can check them out at jewishinseattle.org. Again, day 1 was Jewish Values and History with Rabbi Seth Goldstein. Day 2 was Federal Issues with Tammy Gilden of the Jewish Council for Public Affairs. And yesterday we had the pleasure of hearing from Jorge Barone from the Northwest Immigrants' Rights Project on what was going on here in statewide advocacy. My name is Max Potashnik. I'm the Director of Government and Community Relations for the Jewish Federation of Greater Seattle. And today with us, we have Cordelia Revels, who's the Director of Immigrant and Refugee Services for Jewish Family Service. And in a moment, I'll go ahead and introduce her, and then we'll start the program. Before I do, I want to take a minute to thank our generous donors at the Federation for making this program available. And also a big thanks to our broad list of co-sponsors, the ADL Pacific Northwest, Bet Olive Meditative Synagogue, Bet Havarim, Congregation Beth Shalom, Herzl Ner Tamid Conservative Congregation, IAC Seattle, J Street, J Connect, Jewish Coalition for Immigrant Justice Northwest, Jewish Family Service, Kavanagh Cooperative, Seattle Hadassah, Secular Jewish Circle of Puget Sound, Temple Beth Am, Beth El, Beth Hatfi Lo, Beth Or, and Temple Deher Sinai, and the Washington State Jewish Historical Society. We are truly stronger together, and with all of your membership and your constituencies participating and being a part of this learning and action, we have the opportunity to make such a greater impact than we would otherwise. In addition, I just wanted to point out that Jewish Family Service really is at the forefront of some of the struggles facing our most vulnerable communities, the immigrant and refugee communities here, some of the ones feeling the greatest impact of COVID-19 on our community. And so today we're going to be talking about meeting the critical human need. How can we directly support immigrants and refugees here in our community? And before we move on, I'd love to introduce Cordelia. So she's quite accomplished. She, in addition to being the Director of Refugee and Immigrant Services at Jewish Family Service, she's responsible for defining their department's vision and mission and managing their program development and ensuring effective delivery of services, which is no small feat, especially in today's world. She started at JFS as an AmeriCorps volunteer several years ago in 2012, and when her year of service ended, she transitioned into the role of the resettlement case manager and then the resettlement program manager, so being with the Immigrant and Refugee Services for quite some time. Before coming to JFS, Cordelia taught English language acquisition on the Texas-Mexico border, as well as in Minnesota, and she received her BA in biology from Oberlin College and her Executive Master's of Public Administration from the University of Washington. Cordelia, thank you so much for joining us today. We really appreciate you taking the time away from, a large list of clients who need your help and support today and now more than ever. And I wonder if you could start by sharing with us a little bit about the work that JFS does generally, and also, more specifically supporting immigrants and refugees before we get into some more meat here.
Sure, yes, thanks, Max, and thank you for everyone who's attending today. I'm happy to be here with you. As many of you might know, Jewish Family Service is a multi-service organization, and so we have a variety of services to meet the community's needs, from counseling and a food bank and domestic violence advocacy to our refugee and immigrant services, which is the department that I have the pleasure of leading. During normal times, our refugee and immigrant services are still supporting newcomers to the community. We have our base program as a refugee resettlement agency is welcoming new refugees' arrivals to the country and helping get them connected to the services that they need here in their new community. We offer English classes, citizenship classes, adjustment of status immigration services. We have a very robust economic integration program working on employment placement, financial literacy of clients, as well as connecting them to financial assets. And then we also work in the realm of social integration. So providing longer term case management support to make sure that our clients aren't marginalized on the edges of the community, but really become integrated into their new home. We our case management can range from very intensive medical case management support to our women's empowerment programming. So we really try and offer a comprehensive array of services to meet all of the needs of newly arriving refugees and immigrants to our area.
Which I can imagine there are many.
Yes, yeah, it's, you know, even during more normal times, it's a very interesting and dynamic field. Needs are constantly changing. You know, we're working with refugees and immigrants from many different countries of origin. And so you definitely need to be able to adapt as necessary to really meet the needs of the communities that we serve.
Absolutely, absolutely. And I think it might be helpful before we get into some of the specific things, as you mentioned, changing needs. I'm sure right now is an epicenter of changing needs for the community if we covered a couple different definitions. So could you clarify for folks the difference between refugee and asylee and what that looks like on your end?
Sure, yeah, and I think that's an area that can be really confusing to people, especially with the way those definitions can be used in the media. So there are many different ways that someone might come to the United States as an immigrant. JFS primarily serves refugees and asylees, as well as those who are seeking asylum. A refugee is someone who has had to flee their country of origin because of persecution or a credible fear of persecution. And so as part of their flight, they have had to demonstrate that they were persecuted or that they're at risk of persecution in order to receive the legal status of refugee. That process is all done prior to arriving to the United States. So someone who's coming into the United States with refugee status has already completed the process of obtaining that status before they get here. Mm-hmm. In comparison, an asylee is also someone who is fleeing persecution, but the distinction is where they are establishing their legal case. And so an asylee is someone who is already here in the country and is currently undergoing or has been approved for the legal status, documenting that they were persecuted, and so they have a right to stay here in the United States in order to ensure their own safety. So refugees and asylees are very, very similar. It is just the legal path that they go through and where that occurs. That is the primary distinction for them.
Got it. Okay. And who is JFS primarily serving right now? Refugees, asylees, a mix of both?
A mix of both. Historically, the refugee numbers are higher just because there are more refugees coming into the United States than asylees. We have seen that shift in the last few years under the current federal administration. But if you look at JFS's history, the last 5-10 years, we've primarily been serving refugees, but increasing number of asylees lately, just given what's happening at a national level.
Got it. And we can maybe get into that more later if we have time.
Happy so.
So moving on, we've all heard a lot about the CARES Act, big federal piece of legislation helping the country hopefully move forward and helping those in need right now during COVID-19. Could you talk with us a little bit about what that CARES Act is doing for refugees here in this country?
Yes, yeah. So there's many great components of the CARES Act. Unfortunately, there are also many elements that have left out the refugee and immigrant communities, especially those who are newly arriving to the country. So I'll touch on some of the more well-known components of the CARES Act. So one is the expansion of unemployment benefits. Refugees and asylees are eligible for those expanded employment benefits, which is great. So if they have a work history in the United States, they are able to access that expanded definition of unemployment. However, like many other folks, there have been challenges in actually accessing those benefits. As you may know, the state, of course, had to update the system to incorporate the new changes brought about by the CARES Act, which obviously takes some time. And then, as with most systems in the United States, state systems can be very difficult for new arrivals to navigate if they're new to the community, if they don't understand the way the government works, and especially if they don't have English language fluency. So we've seen that while they are eligible for some of those employment benefits, it's been very difficult to navigate the process, and they really require someone's assistance. And in our case, our case managers are able to help them with that. The other barrier that we've seen with accessing unemployment income is just, as I'm sure many of you are aware, the state system has been really overwhelmed with the number of unemployment applications coming in. And so there is quite an extensive backlog and difficulties getting through the system just because of the number of claimants coming through. So right now, we have a number of clients who are eligible for benefits and are still kind of working their way through the system, but haven't yet started receiving the income, which can be really difficult given that many of our families are working in low-wage positions where they don't have the opportunity to build savings for this interim time period. Another component of the CARES Act is the one-time federal stimulus payment. It is dependent on your income, but many of our clients, if not all of them, qualify on an income level. However, it is also dependent on being classified as a resident according to the IRS definition, which leaves out many of our refugee clients who have arrived in the past year, unfortunately. So just based on their date of arrival, they're not receiving that benefit at this time, which is particularly difficult given that they're also the families who have very little income history here, haven't been able to build up any or very small amounts of savings. And so not being able to access that fund is another challenge with the CARES Act, unfortunately. And then the final component that's been a challenge for our clients to access with the CARES Act is the paid leave provisions. The Department of Labor has applied those to companies that have 500 employees or less. And a number of our clients do work for very large companies. And so they're unfortunately not eligible for those, for that provision.
Got it. We've heard a lot this week so far about the limitations, particularly on the stimulus checks and who can receive them and who cannot, and who can receive them based on who's in the entirety of their household versus their particular status. So that's been a really, really challenging piece for us to hear. So, you know, the news is changing constantly. Obviously, there are changes in regard to what's happening with the virus, changes in regard to policy, changes in regard to benefits that are accessible. How are the clients that you serve able to access information about what's available to them and what's going on?
Yeah, that's been a major concern of ours as a service provider in making sure that the refugee communities are able to access accurate information, both in terms of the benefits that they're eligible for, but also in terms of what they should do if they do start to feel sick, or what symptoms they should be looking out for, how can they protect themselves against the virus. And so the last few weeks, a lot of our team's work has been pivoting to calling current and former clients and doing needs assessments with them, and also providing them with as concise as possible information on some of the major benefits that they're eligible for, making sure that we're helping them access those benefits if there's steps they need to take, but then also making sure that they have the information they need about the virus itself. Obviously, there's a lot of misinformation out there and a lot of fear and anxiety, and things are changing on a daily basis. And so our team is working really hard to stay connected to clients and to reach out to families we worked with previously to make sure that they know that we're a resource for them if they have questions now or if questions come up in the future. But we really want to make sure that our communities have access to this information, recognizing that typically these are the marginalized communities that are not accessing the benefits they're eligible for, that aren't able to access medical care when they need it. So really trying to put the onus on our team so that that we can make sure these families have that information.
Yeah, it sounds like in addition to the information challenges, there's also a big challenge with just getting people the services that they need. How have you guys been pivoting in terms of social service delivery to these clients during this challenging time?
Yes, yeah, that's definitely been a challenge when so much of our model before was working directly face-to-face with clients. We're fortunate in that most of our staff are coming from the refugee communities themselves. And so we have a number of languages on staff that coincide with the languages that our clients speak. And so really shifting to doing a lot of calls instead of meetings that we would normally do in person. We have shifted to providing some workshops over Zoom that we would typically do in person. But it's really a challenge when you're working with a population where not only there might be English language proficiency issues, but also not all of our families are computer literate. They might not have access to computers or smartphones. And so really trying to work around those barriers to make sure that all of the families we work with are getting this information. I think another challenge for our case managers is there's just so much anxiety and fear during this time. And our role as social service providers is not only to help our clients navigate the systems, but also to provide emotional support and to just really be there. And it's difficult transitioning that relational component of our work to a more remote model. But we're doing our best just to be in really frequent communication with our families, making sure they know they can reach out to us at any point. There are very, very limited services that we still are doing in person, but that is on a very limited basis. We've also incorporated doing home delivery for food and medications for some of our families that are in higher risk situations. So trying to make sure that we can make sure they have the items they need without them needing to leave their home. So it's required a lot of pretty quick pivoting on our team's part. And I think like many community members, we look forward to getting back to a point where we can meet with our clients face to face and be in their homes, and they can be in our office. But right now, we're really trying to provide that support as much as possible remotely.
Absolutely, yeah. And you spoke. I imagine that must be quite challenging to say the least. There's so much lost in translation. And communicating when we're not in person, so much that's nonverbal, for sure. You spoke a lot about the fear and anxiety that your case managers are hearing from the clients they serve. Can you talk a little bit more about what kinds of challenges and sentiments and kind of upheaval is happening in the immigrant and refugee communities and the clients you serve? What are you seeing and hearing?
Yes, yeah. I mean, like many other communities, one of the biggest challenges is just the job loss. Currently, we have 57 households we're working with who've already lost their job due to COVID in the last 4 weeks. And again, these are often low wage positions where families aren't able to build up savings to help tide them over until the benefits that they're eligible for start coming through. So there's a lot of anxiety around how families will not just pay their rent, knowing that there's a moratorium on evictions, but how do they even access like basic hygiene products that they need day to day? If they have no savings, there's no way to even get those basic daily necessities. I think there's also obviously concern around some of our clients who do still have jobs that are essential businesses. They're frontline workers who are putting themselves at risk so that our community can continue to operate. And we've heard from a number of clients the anxiety that brings with them as they continue to do those jobs, but then they come home to often what are multi-generational families, with grandparents living with them, with young children, and just as they try and navigate continuing their position as an essential worker, but also the concern that, they're living in small apartments with their families and the risks that they're putting themselves and their family in to continue those essential jobs.
Absolutely.
Another huge source of anxiety, and I would say actually the largest one really that I've heard from both staff and the families, is concern for families who remain in their country of origin or who are displaced in other parts of the world. So in many of those areas, there is not the medical or hygiene infrastructure that you need in order to go through a pandemic like this. And many of those, many families are in really crowded conditions in detention centers or refugee camps overseas. And so I think for a lot of the families, the thing that just provokes the most anxiety and fear is worrying about their relatives who they've left behind, knowing that they are also going through this crisis, but without any of the support or infrastructure that the United States does have.
Absolutely. That must be really challenging and terrifying, knowing there's really not that much that they can do in terms of the global piece. In terms of what we can do here at home, some of what we can do to step up. I know you spoke about not having, those who have lost their job, not even having funds for basic hygiene needs. And I wonder if you could talk a little bit about what we might be able to do here.
Sure. Yes. So obviously during normal non-pandemic times, JFS has a variety of volunteer opportunities where community members are working directly face-to-face with our clients, whether that's in our English or citizenship classes or as a family mentor. We have also shifted some of those roles during this time. So some of our experienced ESL tutors are providing English lessons over Zoom for clients who do have some basic computer literacy skills. We have a number of clients who have professional backgrounds and they're working to try and get back into their career here in the United States. And so there's opportunities for people to give feedback on LinkedIn profiles, on professional resumes, to do practice interviews over Zoom. And then in terms of trying to help families just meet those really basic needs, we've been fortunate to have some congregations who are doing drives around some basic hygiene items so that our team can then drop off at these families' homes some of those very basic daily essentials so that they can continue, with some degree of dignity their daily lives while we're trying to get them connected to the benefits they're eligible for under the CARES Act.
Absolutely. And, that brings up a good question. I know I myself have been wanting to donate some items. How do you make donations right now to JFS if it's potentially food? Is the food bank open, or hygiene products? How do people go through that?
Yes, yeah. So if you go to the JFS website, there's a link to our volunteer page, and then you can see a variety of opportunities there. There's also a contact us function that you can that you can use that can connect you to our volunteer services department, and then they can work with you from there to help get you to opportunities to contribute.
Got it. So really looking at that link on the JFS website and making a phone call.
Yes, yeah, there's a variety of ways to help and contribute during this time, and needs are constantly shifting in the community. And so if none of the things we've mentioned today or none of the things on the website fit with what you feel like you can provide, there's no harm in reaching out and seeing, as needs are really shifting daily.
Absolutely, yeah. Just a reminder to folks, we have just a couple minutes left here, and I think we have time for one question. And I saw a question come in before that I'm not quite sure I'm going to articulate properly, but I'm wondering, how does JFS interact with undocumented immigrants? Do you have any interaction with them? Can they access any JFS services? What does that look like?
Yeah, that's a great question. So most of our programming is working with folks who have refugee or asylee status or are going through the asylum application process. So maybe haven't been determined if they're fitting that status, but are in the process. A lot of our services are government contract based, and so those obviously come with eligibility criteria that the government sets up. But we do have a county based rental assistance program that we operate in collaboration with Solid Ground, another great local social service provider, in which we are able to serve folks regardless of immigration status. So while most of our clients are refugees, asylees, or asylum seekers, we are able to work with folks without documentation in that specific program, providing rental assistance.
Got it. Thank you. I'm seeing a note in the chat box that folks want to have the link for helping put in there. Unfortunately, I apologize, I can't do that right at the moment because they're all hyperlinked and I would have to open up a bunch of tabs on my computer, but I promise that we'll send those out in the thank you email, and they'll also be posted on the Federation website, the landing page for this event. So with that, unfortunately, we are going to have to conclude our program for today. I know there's so much more we could talk about and cover. Again, there'll be a follow-up survey that will pop up in folks' windows when we close out. So if you take a moment to fill that out, we would greatly appreciate your feedback as to how we can continue to provide great advocacy and learning opportunities and how we can improve upon the service delivery. This is a new virtual world for all of us here. In addition, as I mentioned, there's a landing page on the Federation's website that is also linked in our thank you email, where you can find recordings of the webinars from each day, as well as the action items that have been talked about by our presenters. Just a great take action button at the bottom. So all that's accessible there. We'd encourage you to share it with friends and family members who weren't able to join us. And tomorrow we'll be hearing from Andrea Sirocco-Nar, who's the co-founder of the Jewish Coalition for Immigrant Justice Northwest, as to what kind of organizing is being done in the Jewish community with congregations, with organizations to support immigrants and refugees, and especially right now what we can do in this time of the global pandemic. And so with that, I just want to extend a big thank you again to Cordelia. Thank you so much for taking the time to be with us today, and to our Federation donors for making programming like this possible, and to our generous list of co-sponsors who have helped to make this week a success. And with that, I hope everyone has a great afternoon, and we'll look forward to seeing you tomorrow. Thanks so much. Bye-bye.